So today we're going to discuss sclerotherapy, which is the treatment of spider veins and varicose veins via injection with Dr. Solomon. So what is the difference between a varicose vein and a spider vein? So firstly, a varicose vein is a dark blue or purple appearance, and generally they're bulging and can be seen under the skin. They also have a cord-like appearance and can sometimes be wrapped around the leg. Whereas a spider vein looks a little bit different. It's more superficial. So it can be seen just underneath the skin surface and it appears like a spider web. It generally looks red or blue in color.
So spider veins and varicose veins can occur due to a malfunction in the valve within the vein, which causes the blood to pool, which leads to that aching and heavy feeling and also that bulging appearance of the veins under the skin. So why does it happen to some people and not to others? Well, there are a couple of factors that determine that. The first is due to extended periods of standing on your feet, that causes pressure on the valves of the veins, which leads them to malfunction. So a lot of our clients have jobs where they're on their feet all day. So things like nursing, teaching, hairdressing, it's really common amongst those professions. Yeah, that's right. Secondly, it's very commonly seen in pregnancy. So during a pregnancy, the mother's circulatory system changes in order to enable the growth of the fetus and support the growth of the fetus. So that can bring on varicose veins and spider veins, and also the added pressure of carrying the fetus as it develops also puts added pressure onto the valves and the veins as well. So aside from that, there's also a strong genetic link. So if people in your family, the women in your family or men are experiencing it, it's very common that you will too.
Yeah.
It's not just something that's seen in females though. We do have a lot of male clients that experience varicose and spider veins too.
Yes, so a really common thing is for a mother and daughter to come in and get their treatments together, or sisters or something like that. So have a look around. If you think that your mum or your aunt or your grandma had them, unfortunately you might be getting them too. So let's have a look at the treatments. How does it work? Essentially what we do is we inject into each vein a medication that causes that vein to collapse. This collapsing of the vein is a permanent result and it can be seen instantly. It disappears essentially like magic. So the great thing about this treatment is that the results are permanent, and we generally like to do a course of treatments coming into the cooler months. We like to treat every 10 to 14 days, and the number of treatments will be advised after your first visit. In some patients, doctor asks them to wear compression stockings after the treatment for about a week or so. And the reason this is so that we ensure that the veins that have been collapsed during the treatment stay collapsed. The reason we like to treat during winter or the cooler months is because sometimes bruising can occur. It's a common side effect from the needle. So it's good to be able to cover them up during the cooler months. Also, nobody really wants to wear the compression stockings in summer. No. So winter is a time and it is upon us. So it's the beginning of the season.
Yeah. The greatest thing about this treatment is that you may be eligible for a Medicare rebate for the treatment. So if it's something that has been bothering you, if it's a concern to you or a friend or your mum or somebody that you know, please feel free to come in and have a chat to us. We'll give you all the information and we'll take it from there.
Bye.
Looking forward to meeting you. Bye.